With a breast reduction, your typical scar pattern will involve a scar around your areola. So, a lot of times people's breasts have stretched the areola. So, the areola is large. And if we're reducing the size of the breast, you also want to reduce the size of the areola to have that proportional result. So, a scar around the outside of it, it usually hides pretty well because it is at an area of pigmentary changes in the body. So, it kind of hides along the outside of that darker pigmented skin, and then incision or scar going straight down from there. So that like lollipop type scar. Sometimes a breast reduction can be completed with just that scar. More often than not, though, I also will include a scar hidden in the crease of the breast. So people will call that like the inverted T or the anchor. And the scar in the crease hides obviously pretty well in the crease. And the reason I do that is I feel like I can much better reshape the breast. It just gives me an extra vector of pull basically to remove tissue and redrape the skin. In discussing the scar burden with patients, it is a delicate topic because I don't like putting scars in visible places. I know patients don't want a scar that's visible that they either see every single day or when they're intimate with somebody. But a breast reduction surgery, you very much have to be willing to accept that scar for better form. And that is a precept of plastic surgery in general. Unfortunately, there is no scarless surgery yet, but there are things that I do technique wise and post surgery to optimize the appearance of that scar. I do a multi layered closure. So it's all about offloading tension on the skin. I do sutures within the breast tissue itself to help optimize the strength of, the repositioning of the glandular tissue and also just to offload of the skin. After surgery, we are aggressive with scar massage, silicone taping or silicone gel. And then also, if necessary, we will do erbium to treat pigment of scars or microneedling to treat texture of scars. Dr. Basu and I tell all my patients what you do after surgery is as important as what I do during surgery. There's a reason behind asking you not to do any heavy lifting, any strenuous activity. I don't want any increased swelling putting strain on those scars. You're going to swell and the swelling is going to take, up to 6 to 8 weeks to go down. So it's hard. I think patients have gone through the trauma of a surgery and the pain afterwards and they want the result immediately. I want that for myself and most things in life. And it very much is a waiting game to see that final result. So I'm with them every step of the way. It's a lot of reassurance and like counseling, but they end up being very excited, happy that they did it.